introduce yourself?
I am Josh Davis. I'm a cardiac electrophysiologist at Ascension, Texas in Austin.
Fun fact, we were co-fellows, you the EP and I was the IC fellow at the same time.
It's a good year.
I feel like I learned a lot from you and I would love to do some product demos with you.
Okay, let's do it.
This is what everybody's been talking about, pulse field ablation.
Yeah, so pulse field ablation, been in development for a long time, but clinically in use in the past year or two, really, and started becoming available to patients. And so there's there are very many new technologies specifically based around pulse field that are in development. We're at the Medtronic booth right now. They have two different technologies that are available to patients right now. The one in front of us is the Pulse Select system, which is used to perform PVI ablations or pulmonary vein isolations for AFib. The biggest difference when you talk about the different modalities, so radio frequency or cryo ablation or pulse field now, is patient safety, and so it has a little bit better safety profile compared to some of the older technologies that we still use, but it may provide some additional benefit to patients from a safety standpoint, and a little bit of efficiency for us in the lab, allowing us to treat patients a little bit more efficient, quicker, and safer.
What is the learning curve like in adoption in clinical practice?
Yeah, so for an EP that's used to doing ablations with other technology, whether that be point-by-point radio frequency or cryo ablation, single-shot technology, I feel like it's a relatively easy learning curve. The technique of the ablation is very similar to everything that we've done in the past.
That's super helpful. So would you say that over the next several years, once we get more data, that this is going to be kind of a predominant method of how you guys treat atrial fibrillation?
Yeah, I think things will change significantly in the next 5 to 10 years. I think there's still a lot of data that needs to be gathered. There are a lot of registries involved in all of these technologies, and so we'll learn from doing over the next few years, and I'm sure that will change the market and what companies then see as an opportunity to provide better tools and how we can improve even these that are cutting edge right now.
Super exciting innovation on the EP side. We need you guys to come to our interventional conferences. And also, what is one thing that every cardiologist should know in 2025 from an EP perspective? What do you wish that we would know?
I just think that there's a lot of options now for treating cardiac arrhythmias. Most commonly AFib is what we deal with, and so I think that getting somebody involved sooner to try to help them manage their AFib earlier on is a bigger emphasis now than it may have been in the past, and so I think it's important to kind of focus on that.
I think that's a really helpful answer, and also just getting the patients to you guys early enough so that you can help to kind of co-manage them and make the right decisions clinically.
Yeah, exactly.
What lights you up as a person outside of the EP lab? What do you do for fun?
I like to get outside. We do a lot of camping with my family and hunting, fishing, and just enjoying the outdoors.